Welcome into the room. It's going up to 64. Well, damn it, cold. It's cold. Mm. Good morning to you. Good morning to you. Good morning, Master Des. How do they do? Mm. How is everybody doing? How is everybody doing? Welcome in the room. Mm. Okay, I got my regular driver today, so there shouldn't be no complication. I already called him. He said he's gonna send somebody at 9:15. It's 8:55 right now. I was here trying to set up my thing. They gave me the okay to get the stuff, but you gotta read so much stuff and set up so much stuff, child. I hope I did it right. I don't know if I did it right, but shit. I was saying before I put it through, like, we can correct it after. Oh, Lord. Mm. Yeah, they gave me the 3K, and I'm at the point where I could get the, what you call that thing? All the good stuff that YouTube got to offer, but you gotta read so much crap, so much stuff. It's not crap, but you gotta read so much stuff. Make sure you're doing it right, child. I'm just playing it by ear. I don't know if I did it right. I don't know. I'm just, I'm sitting there trying to read it and dozing off. So I said, let me get this live started before. Uh, they said they're gonna check it out. So I don't know when they're gonna give the okay for it to go through. The hair. I did my best. I hope it. Ooh, it's a cold day. They're saying it's gonna get up to 60 something. Same with my heating pad. So yesterday I did the physical, and then that damn doctor was telling me about, oh, the last time, because I took some, hello, ambitious, welcome. Last week I had to do, I had to see the doctor last week. I think it's Friday I saw them. So I had to do some blood work. So she's saying, she look at the blood work and she's saying something might wrong with my liver. Do these people, these doctors just want you to be sick? So before I left yesterday, I did do some more blood work again. And if these people tell me anything else wrong with me, I don't want to hear it. Okay? I don't want to hear it. She was saying my I still look anemic, but I've been taking iron pills for so long. Why am I still anemic? Hit the thumbs button, guys. Let me take this video and put it on my. Let me switch to my other channel and then put it to stream over there also. In order to do that, I gotta switch the channel. So this is how you get your stuff to play on multiple channels. If you have multiple channels, make another channel if you only have one. So I'm going to click up there. See both channels right there. So I'm going to click on my second channel that I have 60 subscribers. Then go back to this name here. Click on that name. Okay, so the video is right there. I'm not going to open the video. I'm just going to hit the three dots that open up. Save to playlist. And add it to one of my playlists on that channel. And see it stream over there also. So you get double. I hit it to live part 2. The thing is that when you put a video over there, it goes all the way to the bottom. Let me see. Let me shuffle. You could shuffle it. So this thing have 94 videos already. I don't know where the video is. But it's in there somewhere. It's showing over there. Oh, okay, I think I see it. Okay, look at it right here. So you see? I'm on my backup channel, so I see it right there. So I'm going to click into it. And type something from this channel also. Let's see if it pop up there. Let's see. Okay. All right. Yes, it's there. And hit the thumbs button from this channel too. So it's streaming on both platforms. So that's my backup channel I just typed from. So I'm going to switch back to my main channel and see if I did everything. Did I pin the link? I think I did, but let's check. Did I pin it? I don't see it. That's Alfonso. Everyone okay, I see the link there, but I didn't pin it. Beep beep. Pin. All right, so it's pinned now. Okay. 901. Let me get all my chargers and stuff that I'm gonna take with me. So yes, yesterday I went to do the physical. Remember I was saying, oh, I don't want to come back home and my son. I have to go pick him up 6 o'clock. Charm. My other son was here and he texted me and say, James came home on the bus. It's like, I was mad, but I was happy. You know what I'm saying? Because I didn't have to go out this 6 o'clock last night to get him from the after school. I was mad that he didn't go to his after school, but I was glad that I didn't have to go there after 6 o'clock last night. Ciao. And I know I told you guys I was coming back live, but after I finish at the clinic, there's a store there's a donut place right next door. I walk over there. They close early, 3 o'clock, but they still had this. They still had this sign up. So I went in there and asked them if they had any donuts. They said they closed, but I saw the donuts on the table. They had them pack up. They said, oh, they're going to donate them. I was like, how much for couple donuts? It's like, whatever. He says, okay, if you have got 12, whatever. 12 I got? Yeah, I think I got 12 donuts. Then kids been having a ball with them. I eat a couple of them. I'm gonna get up and run to the bathroom. This is my regular pickup driver coming today, but I still need to start moving because this leg is stiff as a freaking board. Oh, oh, I need to get up. I need to get up. Hold on. Let me turn this off. My heating pad. Let's shut you off. Ooh. What is this doing? Ugh. I do that damn kid. Child. I don't like pain, but damn. That surgery gonna put me in more pain. But after the pain comes the healing, and hopefully the damn pain will go away. But you know what I gotta do? I gotta keep moving it, or the pain gonna still be there. I gotta keep moving it. I gotta exercise it. I gotta do what the PT tell me to do. Oh, that sucker will still be stiff. But let me run to the restroom right quick. I'll be back. So yes, I was happy I didn't have to go. And today he get up this morning talking about he's sick. Well, he been coughing for a couple of days now, but I've been still sending him to school. But he was looking for excuse to stay home. They have half day today, so it's okay. I think it's teachers conference. I think I missed my teachers conference today. Too much freaking pain. I need a second me. I don't got time to go over the day in school. I gotta call the teacher and see if he could do over the phone teachers conference with me. Because my rides them is only my rides them that I get is only for medical transportation now. If I need to go anywhere else, I need to take the city bus to get to his school. It's like two bus. I could take a Uber or taxi, whatever. A Uber would be about $10 or so. Tax. $10 go, $10 come. According to what time of day. I'm just assuming it's 10. Sometimes I say it's 10, but it's not 10. It's more. It's gonna be more than 10. Because you know, according to what time of the day, the Uber is more expensive. But I think my thing was last week. Teachers conference. I gotta call the school and see if the teacher could talk to me over the phone. Because he's in fifth grade now. I never met his teacher yet. He have a man teacher. First time he have a male teacher. Since he been going to school, let me start getting up. Ugh. He never had a male teacher. He always have. Well, his main teacher. He probably have a male teacher for different subjects. But I mean his main teacher. Because you know they have different subjects. They go to different classrooms. But his main homeroom teacher has never been a man. So let me phrase that right. His main homeroom teacher has never been a man. But obviously you have a male teacher for other subjects because it's not the same teacher teach all the subjects. They have to go to different classrooms for different subjects. Okay, let me put this charger down here. Try to go to the restroom and I'll come back and talk to you guys. So yes, guys, I'm going to the doctor. I know the doctor's supposed to give me this wash today that I'm gonna use like the night before the surgery and the day after surgery to prevent infections. So I'm going to go to Stanford, Connecticut to see my surgery doctor and So yesterday I ordered a whole bunch of stuff and thing. I've been drinking my Gatorade. The groceries never shut till after 4 last. Well, the pickup was, the drop off was after 4. I remember I was having a hard time figuring it out. Let me run to the restroom. I'll be back. Just keep liking up the live, guys. Mm. I was having a hard time figuring it out yesterday. The stuff wasn't going through. I had to call the lady and let her put it through manually. Everybody wants to use website, and then when they get on the damn website to pay, the stuff don't want to work right. Mm. So I think I had 41 minutes because before I paid, I set up a delivery time, and they say I only have 41 minutes from the setup to finish pay and all of that stuff. It was taking extra time, so I lost my delivery time from 3, I think, from 3 to whatever. So I think the guy dropped off after 4, almost 5 o'clock last night. I'll be back. I'm going to the restroom. And then a lady called me today and said she wanted to come over to have lunch. I guess as nurse. Remember I told him my doctor. I'll talk about that when I come back. James, go on upstairs. I'll find to get you. I don't want you under the blanket. I can't have you stay down here. No, take your head from under the blanket. Oh, you have a sweater out there in the chair. Put it down or something. Put down a long pass. Well, if you're not coming down here now, you need to go up there. Oh, wow. Come on, James. I said, come on, go upstairs. Yeah. I don't understand why this phone don't want me turn. The older phone let me turn to. I gotta look for one of my thicker scarf. This scarf is too damn thin. This shit can't do nothing. So yes, I hear outside. Let's see. That's probably the driver calling me. I don't know. I can't see out the damn window. Let's just go to the door. I can't see. The one looking for excuse to stay home saying he's sick. But he is kind of sick with a stuffy nose for the last couple of days, but whatever, I can't be bothered with it. Wait, I turn on this light since morning. Nobody turn off the light. Alfonso, I'm gonna leave now. James in the room, they're watching for me. Let him get out the bed. I need that bed fixed up. Ah, fridge. Come on, people. We're gonna go. The driver reach. My driver is here now, so I'm gotta go. None of them ain't saying like they turn off the damn light. My other one ain't get up to go to school again. These kids get on my freaking nerves. Let's see my ride. My ride is here. Let's go. Let's see who is it. Oh, my friend. Oh. Hey, morning. You can rest this day. Thanks. Mm. Yeah. Ooh. I'm gonna see the doctor who's gonna perform the surgery. I'm gonna see him today. I'm gonna give me all my last surgeries next week. I hope so. Because I'm tired of this pain. When you guys met me, I know I wasn't walking this bad, but dang, it seemed like I just got worse. Ugh. Okay. No, I gotta fight to get my leg up in there. paint that building in black. What's up with these people who painted building in black now? I see the people in HGTV doing that. Now people around the neighborhood starting and painting everything in black. Black is a depressing color. If you need some help with food stuff, you could go in there. What a police doing? You wait till you reach right there to stop us. Ugh, you wait till you reach right there to tell us to stop. Coming soon. I never see a town where building could come in and leave so fast. Everybody wanna open a build, but there's so much competition that some of them don't last. So much restaurants. What do you want, Dunkin' Donuts? David Levy rocking you. Thank you. Oh, damn it. You my pickup driver too? Okay. All right. Before we reach. Ooh, I just gotta get my walking step.
back together. Ooh, fudge. Mm. This, I was in the car falling asleep. I was tired. Okay. Mm. Yesterday I went to this place and get some new stuff to put at the bottom of this thing. This stop make all that damn noise. Thank you. Mhm. All right. Have a good day. Hello, sir. Good morning. Yeah, I'm always tripping over these rugs.
Up, there it goes.
Oops.
There it goes. Okay, you got it.
Oh God. I'm gonna do a knee replacement surgery next week, man. I'm gonna do a knee replacement surgery next week. I hope but I'll be walking better than this.
Yes,
I feel since I've been coming here, I just got worse and worse.
I bet.
I wasn't walking like this. Oh Jesus. Alright. Mm. Guys in the building. Let's get some here today. Child, if I didn't have this thing for support, I'd be flat on my face already. These walkers guiding me along. I just have to lift one leg and drag the other one. Mm. 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 I'm gonna check and see what's up in this bag. This thing is heavy. What's the charges? Mm. Mm. Okay. Come on. Let's see here. Okay, where I can find this thing. I didn't check it out. Mm. This is it. And the Wi-Fi for here. Let's do this before Hi Sharon, just got an appointment to see the doctor before the surgery next week. He's gonna give me the final do's and don'ts, what not to do before the surgery. Hmm. Can you hear me? I can't really take the painkiller because they say it's certain medication I can't take before the surgery because it will cause bleeding and all kind of stuff. So there's a whole long list. He posted this in my email. So stuff I can do to drink a lot of Gatorade. Yesterday I ordered even sugar. They have three cases for $19 each case of Gatorade. Cold. When I first started coming here, I was not in this much shit. I don't know how I ended up with. I was not in this much pain. My driver yesterday, back home was a young guy. So he was 30, I think. He could be my son. I think he said he went to school with my son, but he can't remember then. He went to school with our father. Maybe if I had a picture, I'd send my phone inside when I told him about my so, so yes, he was telling me about this thing. Yeah, you know, I'm at doctor's office, Stanford. The doctor is gonna do the surgery, so I'm seeing him today. I'm over in Stanford. I think I had one of these already. They leave these on the table. You come in and read them. I think I read it. Yeah, she was a ballerina. And I think she was having a hard time. She did the surgery. She did a foot. Yeah, I just need a whole bunch of medication I have to stop using. Not even milk. I can't even drink any milk till after this surgery. You guys hear me good? Because I hate having one of my APs. You hear me okay? Jamaica is underwater. Wow. Chris, how did you hear that? I was on YouTube and I saw somebody channel was talking about they were at the beach. So I really didn't see anything about what's going on. Cause that rain. Oh, sorry to hear that, my dear. There's always something. Mm. So when you build a house, then you have to build them strong. Build them up. You have to start building house them and still. You build them strong enough to withstand the weather. But you know, with time, the place is prone to getting flood. We had an area in our town, it's called Water Street. Back over there, there's trees right there. So every time we have high tide, some of these wicked people. Yes, too much wicked people all over the world, but it seems like a lot of Jamaican people. What's up with them with all this killing? Man, it's killing crazy. And all this cussing. I went to my Facebook, it's like, oops, one, I slipped if I swipe, I don't want to hear it. I don't want to hear it. Mm, mm, yeah, let me show you. Not a lot of people here, but let me show you where I'm evil. Yeah, that's empty. This is, this, I don't know what to do. Mm-mm. All the chairs, but they're empty. Mm-mm. I'm a body. Yesterday I went to the store next to I went for my appointment and I buy this thing to put on the bottom because it was making a whole bunch of noise. Mm, yeah, but it's not- I think it's something wrong with the wheel today. The wheel don't seem like it's moving. I gotta have the doctor check it. The wheel don't seem like it's moving right. I gotta ask the doctor if he could check it out for me. Because it don't seem like the front wheel spinning. It's just making it weird sound. That bigger one. I didn't buy it in there. I went to this facility that they lend it to you until they lend it to you for 6 months, and if you need it for longer, then you call them and let them know. I got this from the bed rail. Oh, God, come on, people. Time to go. Hey, I reached the room. Mm, see, look, that's how my knee gonna look. Oh my goodness. There's two different ones. I think I'm gonna get the one with the silver in the middle. Mm, I got my wash. She said I'm gonna start using it tomorrow. I'm waiting for the doctor to meet it. Okay. So yes, this is my wash. I'm gonna start dating from tomorrow until the day of. He's still there? Okay, look at that. That's what my knee gonna look like when I'm done. Oh man. Jeez. So I'm just in my little room waiting on the doctor. Oh, Jesus, yeah. Oh, Jesus. I had so much freaking pain. That can help. No, well, this is to bathe with. This is to prevent like infection. So I gotta bathe with this. I thought they were saying just the day before and the day after. She said I have to start using it for 5 days. So the 5 days start tomorrow. I wanna bathe with it. I'm not supposed to put on no lotion. Nothing. So she just gave that to me. I'm waiting on the doctor. This white guy. I think he's and that's what my knee gonna look like. Ooh, I'm gonna have a big cut on my knee, but if this pain is gonna go away, I'm gonna be back. Look at this up on the back. Is he gonna come back to the door quickly? I have to mute it. I'm just gonna do it. So mute it real quick. I'll leave it right there. Cover it up. I don't want him to see it. So I'm gonna leave it in. Maybe I'll leave it down. So he can't see it. Oh Jesus. I have to be at the hospital like for 7:30 in the morning. And, uh, ugh, I'm depending on it. So I remember when I told you I went to the doctor last week. When I went to my regular doctor because they needed okay for us that clearance. So I told him I'm gonna need some assistance. So he sent out my name to an agency. Let's see if I can see from this one. So the lady called me this morning and said she want to come over. So they keep saying, okay, I'm gonna be okay, I'm gonna be okay. But if they have people could come over and help me clean up and cook something for me, and okay, why not? Yeah. Yes, I'm gonna be okay, but I'm gonna be in pain. I'm gonna be in more pain than I am right now because I gotta go through the pain first before I heal. Pain for wow. Be safe now. I covered. Mm, mm. Can't believe I end up like this, man. I wonder if this is how my mom feels. I have to call my mom. Cause she did what she stubborn self. How much years now she going through this and she won't. I don't know if she goes to doctor. She won't go and get no help. I told her I'm gonna do the surgery. She said, okay. I said, why don't you try to do that? She said, no. Mm. I'm only doing the surgery, child, because I have insurance. My insurance is covering for it. You think if I didn't have insurance, I'd be ready to go do this? Ah, mm. I have the state insurance, so I gotta pay for nothing, no doctor visit, none of that, no medication. It's covered. No, if I didn't have it, maybe I would be thinking, okay, I'm gonna have a second thought. But mm, but it's because I'm not moving it like I need to. That's why one lady told me yesterday, make sure you move it, because it doesn't matter if you have the surgery now and you're moving it, it's just gonna feel the same. You gotta thinking they've got my physical therapy stuff under the place and just try to do, they keep, they have to keep moving it every day. That's the instruction they send out 3 times a day. Um, I gotta do some reps, 10, stretching it out, pressing my knee down, 10 about that 20. But most of the exercise have to be laying on my back and pressing it into the pillow or the bed or whatever. Mm. Friggin' thing. Mm. Just wanna scream. My blood pressure was like 130 something over 84. I think my blood pressure was, yeah, trying to get James ready for school this morning. He's like, "Oh, I'm sick, sick." We do have a cold for the last couple of days, but I've been sending him to school. But today they have a half day, so it's okay. I have wanted to watch him because he had this bad cough. I never made a child go get sick, so mm, any breeze blow, he's sick. Mm, easy to catch a cold. Mm, I took a flu shot yesterday. I'm not I have shoulder. Even though my shoulder in so much pain, I still took a shot. I took a flu shot and I went to the um place and get some blood because the doctor talking about something, but really I don't need another problem. Do you guys take a flu shot? Yeah. Then she was telling about some other COVID-19 booster. It's like, you know, every minute I want to say something. If it even happen, hello, I don't understand anything. Hold on. Let me take out my headphone. I have one headphone here. Could you hear me now? I'm waiting for the doctor to come in. Can you hear me now? That's why I don't want to have it because I'm not supposed to be loud. I take out the headpiece. You hearing better? A little? Okay. Yeah, I'm waiting on the doctor to come talk to me about this surgery. Next Wednesday for the surgery. Knee replacement. Oh, Jesus. Yeah, well, see, now I got a.
Any changes or no, everything's kind of equally as bad as.
It's very stiff.
So we're ready for surgery in a couple weeks, not even
Weeks. Next
week and a half,
Wednesday.
Yeah.
Next Wednesday.
a week, less than a week.
Yeah.
I'm bad with, I can't keep my days straight anymore. I was looking through your chart, all the labs looked fine, you saw your primary care doctor, and they said that things looked fine. Yeah, 8 days, that was close. And they set you up with some social services, right? Like visiting, aid and things like that, or they're trying to.
But somebody called me this morning. I told her I had an appointment, so
Okay.
she's gonna call me
That's fine.
back.
Yeah, that's fine.
And get reference.
What questions do you have? So we're planning on the left knee replacement, correct? In 8 days, on the 22nd. You live alone, right?
No, I live with 3 of my sons.
Oh, okay. So you have people at home to help.
I live alone still.
Well, yeah, but you're not like literally alone if you were.
I'm not alone, but they still in helpful.
No, I understand, but that's good. At least, basically what I'm getting at is if you were home and you had a fall or something, you wouldn't be like alone on the floor. You could call for help. Not that I'm hoping that's not going to happen. That's good to have people around. So the surgery itself, let me just take a look at your knee today. Good. Range of motion is,
Oh.
I know.
No.
Make it as straight as you can. That's it, huh? Okay. So it's about 25 degrees short of all the way straight. Now let's bend it, okay?
Okay.
Bend it as far as you can for me.
Bend it back a little. Straighten it.
Can you go any further? Good. So that's about 100. So, that's limited, obviously. That's less than normal. It doesn't take a rocket scientist to know that. But so hopefully, the goals of surgery are to have less pain and better function, better range of motion. I mean, it's often not zero pain, so I think it's important to recognize that. But I think you'll be a lot better than you are now. And there is pain after the surgery. Especially the first week or two is the toughest in terms of having pain and swelling and bruising and whatnot from the surgery, which is to be expected. And we'll give you many different kinds of medication to control that as best we can. The most important early goals with therapy after surgery or the early goals in general are pain control and swelling control. So, keep your leg elevated and ice it when you're not up and around doing things, and range of motion. So like getting it all the way straight again and bending it normally again. Those are the most important early goals.
Okay.
The surgery itself is usually between 1 and 2 hours. The goal is to have you walking the same day once the anesthesia wears off with the physical therapist in the hospital. We'll plan to keep you overnight, and hopefully you're ready to go home 6 days. I don't know where I got these from. Hopefully you're ready to go home the next morning, but we'll see. I mean, if you need more time, we can give you more time. And the goal, I think, is to get you home as opposed to rehab, because when we talk about going to a rehab facility after a knee replacement, it's a nursing home, and I think you'd be pretty miserable there. So we can do that. That's a backup option if you can't safely go home, like if you're not walking safely enough to go home, but I think you will be. Okay.
So how about going up steps? Because I have a couple steps to go up.
You'll be able to do steps. I mean, I imagine you have a hard time with steps now.
Yeah,
So I think you'll be able to do them at least as well after the surgery. But we'll see. That's one of the things. The therapist will do steps with you in the hospital before you leave.
So how soon after the surgery would the therapist come?
Well, physical therapy will start in the hospital same day as surgery. And then we often set up a visiting physical therapist to come to the house for the first like 2 or 3 weeks after surgery. They usually only come like twice a week or something for like an hour. It's not like a ton of physical therapy, but the most important things again for you to be working on, and you don't really need a therapist for this, is elevation and icing and range of motion. So by range of motion, you can work on getting it straight by by keeping your leg up with a pillow under like the calf or something to work on like doing that kind of stretching. And then in terms of bending it, you can just sit in a chair and let gravity help bend it back. So you don't need like a therapist for those things. And then we'll get you into outpatient physical therapy when you're feeling a little more mobile.
Okay.
Okay? What other questions do you have?
So how long does the stuff last? Is
The knee replacement? So it's a good question. I'm hopeful that this will last 20 to 30 years, but I can't guarantee that, obviously. And you are the younger side, so there is, a fair chance that you'll need a revision at some point in your life. Hopefully that won't be for decades, and it may be never, but that is a risk, with having the surgery, especially at a relatively
I'm younger, so you only see older patients
No, I didn't.
who do the surgery?
Well, yeah, I didn't. That's what I meant. I just mean like you're relatively young to have like knee arthritis this bad, essentially. But it is what it is, right? I mean.
So is it because my mom have it? Why I have it like that?
There's probably a genetic component. You're on the heavier side, and that's a lot more stress on the knees. But it is what it is at this point. In a perfect world, we'd wait until you were older, but it's already severe, right? So I mean, exactly. Yeah. So I think some people, especially, maybe 10, 20 years ago, would have told you have to wait, until you're older to do it, but I don't think you have to wait. I mean, the risk of doing it at a relatively younger age is that you may need a revision in the future. But if you're at the point where you can't live your life the way you are now, which I think you are, then I think that's a risk worth accepting. But ultimately, that decision's up to you. So we can fill out the consent form.
Okay.
So, we already talked about this. Oh, damn it, these signature pads aren't working, so we'll have to. Let's use the mouse. The benefits of surgery are less pain, better function. And we'll talk about the risks of surgery too. So this consent has your name, Andrew Jacobs, Thomas Hickernell, left total knee replacements, possible procedures. I'm putting robotic assistance. So I often use robotic assistance for knee replacements. So that doesn't change anything from your point of view, same incision and everything. I put a couple pins in the bone during the surgery, and that have these optical arrays on it, so the computer knows where everything is in 3 dimensions, and it helps me plan out and make your surgery more kind of patient specific for you. I can like make fine-tune adjustments to the plan to hopefully help it come out better.
So I'm gonna put on that stuff after to like straighten it, because I saw like a video. I can't remember what it's called. This stuff you put on the knee to try and straighten it out.
There's not really a thing you have to put on the knee. The straightening, like I said, the best way to work on that is just to put your leg up and do this. That's the best way to stretch the back of the knee there, which predictably, unfortunately for you, is going to be a challenge because you haven't gotten it straight in a long time, right? So all those muscles and everything are really tight. I can promise you we're going to get it totally straight in the OR, but it's going to want to go back because the muscles are going to want to go back to where they were. So it's going to be something that's going to, I think it's worth acknowledging is you're going to have some pain in the back of the knee as you're trying to, stretch that back out. Okay. So just going through the rest of the consent, we talked about the reasons to do it, your joint pain and dysfunction, and then the risk. So we talked about the risk of stiffness after surgery, because that's the best predictor of post-operative range of motion is pre-operative range of motion, right? And you're really stiff now. So like I said, we're definitely going to get it better, but it's going to be, you're going to have to work at it. It's going to be a challenge afterwards, just keeping it stretched, okay?
surgery?
There's risk of bleeding with the surgery. We can give blood transfusions if necessary. It's not usually necessary. Infection is always a risk. We do everything we can to lower the risk. Part of that is the pre-op, testing that we did, the antiseptic soap in your goodie bag. Everything's sterile in the OR. We'll wash you up again in the hospital. We give antibiotics during the surgery. We do everything we can to lower the risk, but the risk is never zero. And if the implants get infected inside, it's a big problem and often needs more surgery to take care of it. So that's why we do everything we can to make it as, safe as possible. There's risk of fracture anytime we work with the bone. Obviously, if something happened, I would fix it, we would deal with it, but that could slow down the recovery process. There's risk of damage to nerves, tendons, and ligaments around the knee. I know where things are and what to look out for. It's just always a risk anytime we do surgery. Most people get a little numbness around the knee, just from the skin incision. That's usually the extent of it, but that's something to be aware of.
So what about like kneeling down on my knee? Would I be able to do that?
Yes, you can kneel after this. It's often uncomfortable, especially at first, but yes, you can kneel on it. There's risk of blood clots after surgery, so put everybody on blood thinners for a few weeks, usually baby aspirin, which I think is our plan for you. You've never had blood clots before? Yeah. That's kind of the main spiel. Do you have any questions?
You think this is right?
Yeah, I think it's gonna, I forgot this isn't working. So that means we have to use the mouse, which is super annoying. I do think this is gonna make you a lot better. Your knees are in really bad shape. Let's see, can you, I'm sorry. Let's do this. Sorry. Yeah, so try to just make a scribble somewhat resembling your signature. So you gotta hold the left button. Yeah.
Oh Lord, look at that.
I'll take it. We gotta get these fixed. It's been like that for a few days. I don't know why. Okay, thank you. This will be shared with you on my chart too, if you want to look through this later. Okay.
I'm not even getting into my chat on my phone.
Oh, why not?
And my phone is almost full.
Oh, okay.
This is not letting me into it.
Got it. Well, you can do it on a computer too, if that's easier for you. But.
Okay.
All right. Well, we're all set for next week. Do you have any other questions?
So, what should I not eat? This, I know there was certain food I gotta stay away from. I know I get a whole long list, but I have to keep going back and look at it.
So not really. So after midnight the night before surgery, so on the 21st after midnight, nothing to eat. Okay. You can have normal dinner and stuff like that. Just after midnight, nothing to eat because you're supposed to have an empty stomach for surgery. You can drink liquids though after midnight and in the morning, and I want you to, so you're not like dehydrated. So you can have clear liquids like water, obviously, like Gatorade.
Yeah, I got some.
You could have like black coffee, black tea. You can put sugar, just not milk. So that way you're not too dehydrated. You can have a little nutrition through drinks, but then you can drink liquids up until the time you leave your house in the morning. Okay. And I think you're supposed to keep taking like your seizure meds and things even on that day. You can take that with some of your water and stuff. Okay. What other questions do you have?
I'm supposed to something. I was trying to get in contact with you for something. I can't remember what it was.
Well, if you remember, give us a call. If you figure out my chart, you can send us
What's
a
the
message
direct
that
number
way.
for here? Cause I keep...
We'll just give it to you at the front. I never remember it off the top of my head. Okay. Do you have Tasha's number or front? We'll give you numbers to call.
Okay.
All right.
So when after the surgery, where do I go back?
Surgery's gonna be at Greenwich Hospital. So that morning, Tasha will tell you exactly what time to get there. It'll be early in the morning.
7:30.
No, I think that's when your surgery's scheduled. So you'll be asked to get there at like, I think 6:30. But she'll tell you exactly what time to come, okay? And then you'll be there for at least one night, maybe two, we'll see. And then home is the plan, hopefully. And then I'll see you here like about 2 weeks after surgery. That's what that appointment's for.
Okay. I have the ride set up already because I don't drive. So
Good.
the pickup is like for 6:15. So that kind of day. Push it back a little.
On the surgery day,
Mm-hmm.
um, got it. So maybe we'll change the order so you're a little bit later in the morning, just to give you more time to get there. Do you think that would help?
I just need to call them now and
Or you just
change
adjust it? Okay.
and adjust it.
All right, I'll talk to Danielle and Tasha and we'll get that all sorted out with you, okay?
Okay. All right. Thank you.
Anything else?
Whew.
All right.
That's good. It might be the day of
I know.
extra stress.
That's all right. Well, and then once you're there and you get like an IV placed and things like that, the anesthesiologist will give you some relaxing medications so you're not so anxious, okay?
Okay.
All right, I'll see you next week. You'll let us know if any other questions come up, okay? We'll make sure you have phone numbers.
Okay, thank you. I'm having a problem with this. It's not moving to it. I don't know if the wheel. I just bought the back piece yesterday, but I think the wheel is not moving.
I don't know. Looks like I think this is how it's supposed to go.
It seems like it's stuck.
Well, maybe you just need to break in those pads a little bit.
Oh,
But I think that's how it's supposed to go.
okay.
Yeah, I'm texting Danielle's usually sitting here, so you can just start making your route to the front and get you information on the front desk, okay?
Because there's a number on Google, but when I call that number, they say that number is not. Can you get
Okay. Yes. I think I put the pickup for 6:15. Yeah, so should be there in time.
Cuando Maxi dice, mami, yo quiero ice cream, mami no dice, Maxi dice, ok, Maxi, ice cream.
Okay, so come here for that. Yeah, but I was telling him I'm having a problem getting into it because my phone is full. So it's not really letting into certain apps. Yeah. But I got the appointment already. They sent me. Yeah, you sent me the package. Somebody just give me another package. Is this the same thing? Yeah. Oh, you said it. I was like, okay. I got you said it because I couldn't even read half those so much stuff in the email. I'm having a hard time reading it. Mm.
It's the same thing, so the other one that I sent you had your appointment on.
Oh, yeah. Okay. Thank you.
So I'll call you just to remind you the time.
All right. I'm gonna do a surgery next week. Yeah, thank you.
Jesus. Mm. Oh. Suck it. Jesus. Mm. Mm. I'm not supposed to be on the live, you know? I'm not supposed to. But the stuff is in the back. I'm gonna get the live. This is my driver. I'm sure if I did it. Let me get to the side here. Forget about. Mm. Mm. Too bad, too bad, too bad, too bad. Damn heavy. This freaking chair is so freaking low. Damn it. I need a high chair to sit on. Fudge. Oh, fudge. People, I'm not sure if I was hearing everything because I wasn't looking at the phone. My bag was covered up. Oh, morning. I'm gonna end this live. And I'm going to call my driver. I'm gonna come back with a different live. Over here, you can't get no signal, but we'll see. Because I connect to their Wi-Fi. So we'll find a different name for the next live and all that good stuff. Just give me a couple minutes. I'm gonna call my driver, see if he's on his way. And hold on, let me grab the other phone and sit. Thanks for watching. Is that him? And start a different live. Let's do this. Thanks for watching. I'll be back in a few minutes.